hall. And I have my stethoscope, and I'm cleaning off my stethoscope also. And I washed my hands already, and you'll just do that with your hand sanitizer. And I'm just going to look at your head, okay? We're going to kind of work our way from the head down. Are you okay with that? Yeah. So I'm just inspecting or looking at the size and symmetry of the head. And then I'm just going to push on your head a little. I'll try not to mess up your hair. And so we push on the cranium. I'm looking for any tenderness. And you can kind of do it bilaterally. Push. And let me know if there's any tender spots there. And then we're going to go ahead and do the sinuses. And I'm going to push on, these are called your sinuses here, and I'm going to push on them a little bit. So these are your frontals, and I'm going to push upward. And so we're going to stick our thumbs right in the inner 1/3 near the nasal bone and push upward. Does that hurt you at all? Good. And on the maxillary sinuses, they're right below the bone. So as the bony prominence stick out, we're going right underneath and pushing upward. Up like that. Any soreness?
No.
Good. And then we're going to go through, and so you're looking for tenderness. You could say, I'm looking for tenderness, da-da-da, or you can ask the patient, you let me know if it's sore here at all. Is it sore? So either way. And then I'm going to look at the symmetry of facial expression. This is, you're going to see this in neuro. This has all to do with the cranial nerves. We're going to stick it in here. Because it's something we do while we're up there, but it has all to do with cranial nerve function. So I'm going to ask you to do some silly things. Could you smile for me? And I look to see that it's symmetric. Frown. Can't do that. Talk out your cheeks. And I'm going to ask you to squeeze your eyes down. Good. And so we're going to look to see that the forehead wrinkles and that everything is symmetric. An example would be if the patient had a stroke. She tries to smile, one side goes up, one side goes down, things like that. So that's why we're doing it. And then we're going to transilluminate the frontal sinuses. And this was that thing where if you have a sinusitis and you want to see if it lights up, we're going to dim the lights. And in this room, you can actually run over there and dim the lights. In the small rooms, you can dim the lights and open the door so it's not totally dark in there. In here, honestly, it's, could you dim the lights? Sure. Honestly, it's too bright. We won't see anything. So we put our bright light on, make sure it's not hot.
Too dark?
Perfect. And then I'm going to just cover your eye for a second. Do you have contacts in?
No.
Okay. And I'm going to shine this light right up in, and you can see her frontal sinus lights up, and that means there's nothing bad in it. And it lights up again. And I'm going to ask you to open your mouth. And we're just going to set it on the maxillary, look underneath. We see the bright light come through, and see the bright light come through. Okay? And you can hit the lights. Thank you. So we transilluminated frontal and maxillary sinuses. Then I'm going to palpate the bones of your face, okay? So the facial and orbital bones for any tenderness. So we just kind of palpate around the facial bones. You don't really need to name them off. I mean, those of you who are in anatomy, you certainly can. But we just palpate the facial bones symmetrically, looking for any tenderness. And we're going to get the parotid glands. They're right on the side of our TMJ, right down by the L. And we're just going to palpate those, looking for any tenderness and seeing that they're non-enlarged and symmetric. And then we're going to go through and I'm going to have you open your mouth and close your mouth and go side to side. And this is the TMJ, and I would ask if there's any tenderness, and I'm noting any clicking. You can do it for the exam. You can just do it right on the TMJ, but while you're practicing, some of you play around and stick your fingers in the external auditory canals and aim toward the patient's nose, and then have her go up and down and see if you can feel any other clicks. Sometimes we'll feel the click just of our external auditory canal clicking as it moves around, but sometimes distinct clicks can be felt that way. But for our patients, we can just simply do this, okay? We don't have to go in their ears. And then the maxillary and frontal sinuses, we're going to push up on, and just, I already did this, push up and push up, looking for any tenderness. So that's that. And then we're going to skip eyes for right now. And then we're going to move on to the ears, which we already did, okay? And then we're going to, we're ripping. And then we're going to go on to the nose and the mouth. You didn't know you were going to come to PA school today and have to be sitting up there with people looking in your schnoz, did you? Oh, and you guys, remember these small, you should get these small little hand sanitizers. Grab one, bring it with you, keep it in your bag, okay? Because then you don't have to run over there and wash your hands, so they're nice to use.
Do you want to just hold it?
I love you, thank you. looking in the nose, okay? So we're gonna palpate we're gonna inspect the nose for the contour, I think it says, and just, we're obviously looking to see the contour of the nose both from the front and from the side. And then I'm gonna push on your nostril here and sniff it. Good, and again, good, and we'll test for nasal patency. And then we're gonna move in, and I think we're just gonna look now. We're gonna go through and look at the turbinates, the mucosa, the septum. Do you mind if I take a look?
Mhm.
Okay. And I'm gonna go up in there. I'm gonna talk it after I get done doing this. Take a look. Look at the mucosa, the turbinates, the septum, and then we're gonna do it on the other side. You don't have to go in. Watch how far I'm going in. It's not very far, and we can see pretty well. I also watch it go in, and then bring my eye up to look. Okay?
Do you have to switch hands like you did with the ears?
You do not. What you don't want to do is have your face in their face, okay? So you really, that's why we kind of angle it like this. We don't flip this one. We angle it like this so that we then are a little bit off to the side. And then I switch hands to go, just so I can make it go this way, but you can certainly keep it in the same hand and go this way. It's just a little better than you being nose to nose with them, okay? But you can keep it in the same hand, doesn't matter. All right, and so the other thing you want to try when you're doing this, please, 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 as you go in, aim a little bit laterally. Please don't aim the little tip of your otoscope to hit them in the septum, where we're going to then have to deal with the bloody nose. So aim a little bit laterally, much less sensitive over there than if you guys, when we're first learning, kind of going and we're going medially. So kind of look toward the other side. As you see the first turbinate there, if you kind of go a little bit around that, you can see the edge of the second one way up there. It's pretty cool, but you got to go in a little bit farther to see that, but it's really neat. And then look, obviously see if there's any discharge and any abnormal findings. Okay, and then we're gonna we'll go through the mouth, and we're gonna look at the color, the condition, the position, any inflammation of the, and you can say all that first if you want, and then you can head in there and start doing what you need to do. Let me get I'm very poorly prepared today. Hang on though, I do have a tongue depressor. New tongue depressor on this, make sure when you're doing this, you're going to use a tongue depressor, and you're also going to need a gauze pad. And the gauze pad should not be opened yet, leave it closed until you need it. And so as we go through, if you use the gauze, I'm going to ask you to,
You don't want to spit my gum out.
you probably can't spit it. You're so good, honey. You're so good. You're so cooperative. Okay. So we're going to kind of head in, and we're going to look at this stuff. So I'm just going to look in your mouth, okay? And I would go in and see whatever you can see for rhythm of how you do it. But I first, go ahead and say and I'm looking at the posterior pharynx, the gums, and the teeth, the gingiva, the buccal mucosa, and the frenulum. And then we have to, if you have to move anything, you can use the gauze pad and a glove and move the tongue over, or lift the lips down. But you want to get a look at everything and take your time in there rather than have to say, I'm looking at all these things. Just kind of go in there, say what you're going to look for, and then every time you see one thing, you're looking at those things.
During the exam, are we supposed to announce the things that, like you just did?
Yeah, kind of like what you're seeing, because you have to have a box there, and
Yeah.
in that case, we don't know what you're looking at. When you're looking at buccal mucosa, we think you might be, but you probably ought to say it. Yeah. And the frenulum, you'll need to, again, with a gloved hand or with a gauze pad, pull the lip down a little bit, okay? Then, I'm not going to do this to you today for your kind benefit, but we're going to put a glove on, and once the glove goes on, as I said before, don't touch anything. And then we're going to go in and we're going to palpate the structures of the mouth too, and go through, and with one or two fingers, if you get too much hand in their mouth, they're going to be gagging all over you. So it's really okay to just use one finger. And so we're going to palpate the buccal mucosa, just ask them to open their mouth, buccal mucosa, the gums, tap on the teeth, in and around to see if there's any tenderness. The floor of the mouth, and when we get in the floor of the mouth, you want to go under the tongue and palpate the floor. So you squeeze your finger that's on the floor of the mouth, and you're underneath her chin, and you're palpating. okay? If you watch my videos, I'm not gonna put you through it today, you guys will be practicing enough. But you'll see it on there and how we do it, it's pretty straightforward. And then throw that glove away, okay? Really put it somewhere in the garbage, and I'll have a garbage by you for everything. Remember, teeth for tenderness, you can either push on them or tap on them, either one. And any lesions, when it states lesions found, you're gonna say if there were any lesions, I would also palpate them, okay? Let's say she had an oral cancer, something, a leukoplakia, you're gonna palpate it and see if it's tender. And then we're going to go through, do you want me to do thyroid real fast?
Yes,
Okay.
please.
So we're gonna do both thyroid, we're gonna do neck, we're gonna do thyroid and lymph nodes, okay? I know thyroid and the head, eyes, ears, nose, throat don't have anything to do with each other, but we happen to be in the neck area, so that's why we're doing it. So thyroid, what we're gonna do, because we're gonna just stand and watch the patient, look at the patient's throat, and obviously looking for any obvious thyroid enlargement, and just see if the thyroid position, and I'd give her a sip of water, can you swallow for me? And I watch the thyroid. If my thyroid was enlarged, let's say there was a big nodule right on the right side of it, okay? And you could see that, you're standing there looking at it, and you could see this thing kind of sticking out. If it's on the thyroid and I swallow, it goes up, but it comes down. So that's the only reason we're having her swallow and look at it, okay? In reality, we don't usually, what I'll do is, in a physical exam, if you were in for your annual physical exam, I'd take a peek at your thyroid, and then I would probably have you just quick swallow, and then I would go back and palpate on it. I don't do quite as extensive as we do here, but we'll go over how to do it. So, and we also look at the position of the trachea. If she was in the ER and she had tracheal deviation, collapsed lungs, something like that, you'd obviously notice that, okay? And then we're gonna palpate the thyroid. We're gonna use a posterior approach. And can you just tip slightly to that way? Perfect. And so what I do is I sometimes will stand right out front, find the thyroid. Our thyroids are in our lower 1/3 of the esophageal area there. And we're going to find the edges of the thyroid. I find one edge, I walk around, and then I put my hands on the other, and I push back and forth, and I rest my fingers right on the clavicles. And so now, I'm going to palpate the right side. And ask you to just turn a little bit and look towards your right knee, just a little. Good. And then I stabilize with this hand, and I press in on this one, and I'm going to ask you to swallow. She takes a sip of water, she swallows. I feel the thyroid go up and down. And I'm also going to really palpate around in there. Some people will palpate first. Once they find a nodule, then they'll have them swallow up and down to see if that goes with it. That's the only reason for the swallow. Okay? Then we're going to go the other way. This is my stability hand now. This hand is on the thyroid. I'm looking for any nodules. Hold my position, swallow, and that's thyroid. So again, mistakes people make is they're either too high, you should be below that little cricoid process there, down below, lower 1/3, and don't include the sternomastoids. Our sternomastoids are there, we need to be underneath them. Okay? There is a posterior approach where we go behind the sternomastoids. We're not going to do that for now. We'll talk about it when we're in the thyroid section. Okay? And then lymph nodes are the next thing we do. We're going to palpate all the lymph nodes. And then if you could say them while you're palpating them, and whatever little rhythm you want to do. Preauricular, the postauricular, the submandibular, submental, the tonsillar, the anterior cervical nodes that go right down along the sternomastoid, and the posterior. Across there. So we kind of hit them all, okay? And try to name them as you're going and hit all the nodes. We're not going to be doing the supra and infraclavicular. Okay, occipital, yeah, sorry, I did them, I just didn't say, I was around the back side doing them. And how you do, you kind of go in circles right on the occiput back there and looking for any tenderness or any enlargement. Okay, so let's practice. Oh, and one other thing, sorry, we auscultate our thyroid. We probably ought to auscultate our thyroid before we palpate it, and just, we put our bell of our stethoscope on the thyroid gland here as she takes a breath and holds it, and we're looking for a little bruit in there, the little whoosh whoosh of increased vascularity of it, and on the other side. So we check for a bruit. Okay? And again, practice is, I'm gonna come around too and do lots of individual, and I'll try to see you as you're doing it, or if you have questions, grab me when I'm walking around.
So you auscultate right next to the trachea?
You auscultate right on, it's for a thyroid bruit, so we're auscultating right at, just above the clavicle in the area of the thyroid gland.
Alright.
We're not, there are other bruits that we can have, in the arteries, and we're not on those today, we're on the thyroid. Okay? And that's it. Practice? Okay, I don't think the other lab's open.